Rich and pain. Are you staying up in the middle of the night searching and searching the internet before finally asking the key question, am I dying? Any of you doing that? I know it's happening. Well, you're probably not, but how do you actually know you're not dying? The best way is to ask a doctor, and luckily we have a few here today to help tell you if your bloat, your bumps, and your body pains are worth worrying about. Please welcome my friends, cardiologists Mark Eisenberg and Chris Kelly. They wrote the book, Am I Dying? Actually, literally, you wrote the book on that question. We wrote the book. Because it's called that. That's the title. That's a good title. So why do you think the book was so necessary? Are folks really panicking themselves?
Well, yeah, I mean, everyone has new symptoms all the time. You can't, for the most part, call up a doctor anytime you have something new. So most people go online, Google their symptoms, and inevitably, no matter what you put in, you're told that death is like around the corner, right? You're like, your hangnail is the earliest sign of cancer. Get your stuff in order. So we wanted to make a resource that was comprehensive, accurate, not alarmist, has no hidden agenda, and just gives people good information, lets them know if it's something that's probably okay, something that's probably not okay and they need to make an appointment for, or something that's definitely not okay and you need to go to the emergency room for.
Of course, we're going to tackle a couple of these topics, ones that ask quite frequently. First off, of these biggest am I dying questions is around bloating.
Yes.
Bloating. Now explain, Mark, what are the non-deadly reasons you may get bloating?
Well,
these are so common.
These are the non-deadly reasons why you might get bloating. These are what we call the musical fruits. There's beans, lentils, milk.
Sure, musical fruits?
Do you know why they call them the musical fruits?
I actually don't know why.
Why?
So I have kids, so probably some people in the audience know this. Beans, the magical fruit, the more you eat, the more you toot, right?
Toot.
Yeah, so.
They sing to you.
Yes, they do. You put these guys in your belly, and the bacteria in your gut digest them and make a lot of gas. And so, I like to have a big, bowl of beans before getting on a crowded elevator. That's how I make a lot of friends.
It builds character.
Yeah.
But it's not just beans, right?
No, it's not just beans. It's beans, it's milk. People sometimes basically don't have the enzyme that could digest the milk. And because of that, the bacteria gets onto it, and it causes a byproduct of
Cola,
gas.
because it carbonates your belly?
Yes, so then there's gum, there's cola. Anything that makes you chew and you're swallowing air will go into your stomach.
Let's talk about gum.
If you chew gum and you swallow air, it goes into your stomach, and it could actually make you feel very bloated.
And in addition to that, why don't you demonstrate? Why don't you, here, take a few pieces. This is a normal amount of gum for a person to eat.
No,
we have right here.
Cardiologists chew a lot of gum,
So, yeah. And it's good for silencing people who talk a lot also. So the gum, in addition to swallowing all that air here, I think you need a little more. In addition to swallowing all that air, the artificial sweetener in gum also gets broken down by the bacteria in your gut and makes more gas. So you're burping, you're passing gas. Your breath smells good, but the rest of you, I don't know.
So, it's a minty friend that we all love.
Yeah.
We chew it often, but we spend all night long coming up with this demonstration to show you exactly what's happening. Keep chewing.
Yeah, right.
Keep chewing, Eisenberg.
So.
All right, so there are two ways, right? The first is you can literally just have too much air in your belly because when you're chewing or swallowing things.
Or drinking carbonated beverages.
Right, but you gulp in air with everything else. So that air actually stays down there, and it doesn't smell when it comes out. I can attest to that. But it does make you bloated and increases your waist size.
So I've been keeping this in my attic since my 8th grade science fair because I knew one day that this would come in handy. And,
so
and I'd like to demonstrate
this is
now.
the mouth.
So this is the mouth.
This is
This is like the stomach and the intestines. Down here is your colon. That's where the poop gets made. And let's pretend that this beaker here is full of the artificial sweetener that's in gum.
Okay, it's called sorbitol.
Sorbitol. So we're going to show you the sorbitol, what happens when we pour it in. So this is a normal amount of gum, again, like 8 to 10 sticks, somebody might have.
So you put it in there.
So you pour it in there, and you can see that the bacteria, these green guys, are processing it.
Ooh. What have you done here?
Turning it into a lot of gas. And at this point, you're foaming, frothing at the mouth,
and not
walking around looking like you have rabies, and you're feeling really bloated.
So you've got bloat and stuff all over you, but examine your partner there, because Mark's been chewing his gum. Is he bloated?
Yeah. I think he's gone up at least 3 belt sizes.
That's normal
right here.
So again, it's not toxic, but the bacteria don't recognize this. When it gets into your colon, it digests it.
It's a meal for them.
Exactly. When they go to the bathroom, they release gas. That gas doesn't smell that badly either. Yeah. But some of the gases that we make smell putrid, right? That bad egg smell.
Yeah.
That's because some of the foods you're eating can do the same thing.
Exactly.
Okay. Is there ever a time when you should freak out if this is happening?
No, I mean, this is normal. I think that if this happens a lot when you eat, you should look at what you're eating. You may be lactose intolerant, for example, and
So when should you
take supplements for that.
If you start having abdominal bloating, nausea, vomiting, and a fever, you should actually go to the emergency room because you could actually be having an obstruction. And only an x-ray and a good doctor's exam will be able to tell you that.
Yeah.
When
It's
you
just
go-
uncomfortable and not painful.
Yeah, and when you go to the bathroom, it should feel better.
Yeah, you should feel better
If
afterwards.
it doesn't, call somebody.
Yeah,
Okay, next, a
right.
viewer found something strange growing on her body, and she's asking, am I dying? Our Asia's here. What was it that you found that worried you and prompted the email?
Okay, so I found some moles, some
Oh.
beauty marks that popped up too.
New beauty
30,
marks?
Yeah, after 30 they came. And freckles, what we call them. Yeah, so I was trying to figure out
Well,
why.
freckles is what I like to call a lot of things, but sometimes they're not freckles. So maybe we can get an expert here.
Yeah.
Take a look at that. What do you think?
Let's see.
And while Chris, while you're examining, Mark, explain why a mole should worry us. When should it freak us out?
So doctors use the ABCDE mnemonic to decide when a mole could be dangerous. So A stands for asymmetry. If one part of the mole looks not the same as the other part, that's worrisome.
So where are they? Sorry.
Yeah, we've got one right here on the cheek. I don't know if you guys can see that.
Actually, you know what? Turn over.
I'm making it larger
Come,
than...
Look over here. Maybe we can see that to everybody. Mark, keep going. So A
Okay,
is
so
asymmetry.
A stands for asymmetry. B stands for borders, being irregular. If it's not a complete circle and it's jagged, that could be very worrisome. C stands for coloring. If it's multiple colors, like black, blue, brown, variegated colors, that could be extremely worrying. D stands for diameter, 6 millimeters, or actually, if we have it,
Yeah, and actually a little tip here. You could take a regular
Look at this,
pencil.
Asia.
This is about 6 millimeters or so. If you can cover the mole completely with the eraser on your pencil, that's a good sign.
so if you can't cover it, it's a bad sign. So if it's greater than 6 centimeters, it could be worrisome.
Millimeters.
Millimeters. E stands for evolving or something new. So if it's getting bigger. So a great thing you should do is when you have a mole, take a picture of it with your cell phone. And then you can compare it, take another picture a week or two later.
As I look at, sorry, Asia, it is evolving because it's new, but you don't have any of the other ones, A, B, C, or D,
No.
and the pencil covered it up. So
Yeah.
should she go see someone or not usually worry?
I mean, it's always a good idea to have a skin exam every few years by a dermatologist because in addition to the moles that you see, you may have ones on parts of your body you just don't see that well.
Your back, your legs.
Especially fair-skinned
Your
people,
hair.
like I'm usually translucent. This is a tan for me. So I am very prone to moles and increased risk of melanoma.
So Star Asia's been taking photos.
Yeah.
So over
Can we
time, we
see
have
'em?
images of them. Take a look at these. Give me a rough idea of whether Star Asia is dying or not.
Well, Starasia, unfortunately, is definitely dying. All of us are dying. But it's not going to be from this, I don't think. This looks like a pretty benign-looking mole. Like I said, I think it's good to get a skin exam every few years, but I don't think that this one has to worry you.
You know, I'm very proud you took pictures of it. That was the most important thing you did. It helps us figure out what's going on. If you go to a doctor without any backup, we don't have much we can do except start cutting things out.
Yeah.
You bring a couple pictures like that, it changes everything.
it does.
A lot of
Nice job.
history.
All right, now what's the classic concern that folks who are Googling are fearful of? I'll just stand in front of you because I'm sure some of you have done this before. The most concerning Googling sign they have is
Chest pain?
Chest pain.
chest pain. It's no
Yeah.
joke. It's a big problem, so we can all agree. So what do you tell patients when they're having chest pain? What's the tip whether should they be concerned or not?
Well, you should usually be concerned about chest pain because of the many things that cause it, most of them are life-threatening. And as cardiologists, we deal with this all the time. The times when you can be reassured and probably not seek medical attention is if you get like a sharp little pain between the ribs, when you take a deep breath and it lasts for just a few seconds, that's probably a pulled muscle. But if you have pain that's more severe than that, it's not related to breathing, it doesn't go away after a minute or two, you should definitely go to the emergency room because you could be having a heart attack or something equivalent.
All right, so we've created a guide that you can use to check your chest pain. It's literally called that, check your chest pain. You can find it on DrOz.com. There's the guide right there. Take a picture of it, send it to your friends, share it around. You might save some lives. Chris Mark, wonderful job, as always. For a complete guide on ways to decode your body pain, pick up Dr. Kelly and Dr. Eisenberg's fantastic book. It's called Am I Dying? In fact, you know what? What about the audience? The audience is worried. Should they be getting something?
They should all get a copy of Am I Dying? And I think we're going to give them all out today.
You want some? You're all going home with a copy of the book, in case you're dying. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.